हेलो स्टूडेंट्स, अभी रिसेंटली एफएमजी एग्ज़ाम हुआ और उसमें बहुत सारे डर्मेटोलॉजी से भी क्वेश्चन आए. सो लेट अस डिस्कस दीज डर्मेटोलॉजी क्वेश्चंस. सो इफ़ वी टॉक अबाउट द फर्स्ट क्वेश्चन, इस क्वेश्चन में पूछा गया था एमडीटी के बारे में, है ना. तो हम सभी को पता है एमडीटी दैट इज़ मल्टी ड्रग थेरेपी. सो मल्टी ड्रग थेरेपी इज़ यूज्ड इन लेप्रेसी, है ना. और ये दो तरीके की हो सकती है, एमबी एमडीटी और पीबी एमडीटी, दैट इज़ मल्टी बेसिलरी एंड पॉसीबेसिलरी. नाउ इसमें 3 ड्रग्स यूज करते हैं, इसीलिए इसका नाम है मल्टी ड्रग थेरेपी. सो देयर आर 3 इंपॉर्टेंट ड्रग्स विच आर यूज्ड. वन इज रिफैम्पिसिन, क्लोफाजिमिन एंड डैप्सोन, है ना. द डोज ऑफ रिफैम्पिसिन इज 600 mg and it is given once a month. Clofazimine 300 mg, it is given once a month, and for 50 mg daily. And the dose of dapsone is 100 mg and it is given daily. Now these drugs in these doses are used for 12 months in cases of MB type of leprosy and 6 months in cases of PB type of leprosy. So now you can very easily answer this question. They are asking that what is wrong in the doses of MDT in leprosy. 300 mg clofazimine once a month is absolutely correct. 100 mg dapsone daily is absolutely correct. 50 mg clofazimine daily is absolutely correct. But rifampicin is not given in the doses of 450. Instead, it is given in the doses of 600 mg per month. Moving to the next question, they are saying that female undergoing chemotherapy presented with hair loss as shown in the image, and you can see there is diffuse hair loss. Majority of the hair follicles are lost. So this is anagen effluvium, because anagen phase is the growth phase where 85% of the hair follicles are there, and when these hair follicles get involved after chemotherapy, patient develops excessive hair loss or patient can go bald after chemotherapy. This is known as anagen effluvium. While trichotillomania is a psychiatric condition where patient pull the hair follicle, alopecia areata is an autoimmune condition where patches of hair loss are seen, and telogen effluvium is again a diffuse type of hair loss seen 3 months after pregnancy, typhoid fever or COVID infection. So answer here will be anagen effluvium. Now all are used in the treatment of acne except, now here you can see that the patient is having comedons, and comedons are seen in grade 1 acne. So grade 1 acne presents with comedons, and in the treatment of grade 1 acne we use topical retinoids like tretinoin is used, adapalene is used, even topical isotretinoin can be used, but steroids are not used because steroids can cause drug induced acne. So steroids become the answer here because steroids are not used. Some of the students were saying that except was not there. They simply asked that what is the treatment, and in the image large nodules and cysts were present. So if it is grade 4 acne, that is nodulocystic acne, then you will choose isotretinoin, which is the drug of choice for grade 4, that is nodulocystic acne. Now here in this image you can see that the patient presented with red, that is erythematous, solid raised areas, that is plaque, where over extensors like knee, elbow, back, buttock, and you can see that there is a lot of scaling also, characteristically silvery white scaling. So silvery white scaling is seen in psoriasis. So this is a patient suffering from psoriasis, and in psoriasis we do Garrett test. Now what is this test? This is a test that when the patient presents with such erythematous plaques with silvery white scaling, we take a glass slide and we start scraping this lesion, and when we scrap, a lot of scales start coming out. So this is known as Garrett test. Garrett means peeling of the skin or peeling of the vegetables, like we garrett the vegetables. Similarly, if you peel them, the scales come out. This is known as Garrett test. Now if you keep peeling this lesion, keep removing these scales, the end result is pinpoint bleeding spots. This is known as Auspit sign. Auspit sign is also seen in psoriasis. Garrett test is also seen in psoriasis. Sometimes they ask about Berkeley membrane or Warnoff ring. So remember that Berkeley membrane is a shiny membrane which is seen when you remove all the scales, and sometimes there is hypopigmented margin around it that is known as Warnoff ring. So if any of these is asked, that is Geretich test, Berkeley membrane, Warnoff ring or Auspitz sign, then answer will be psoriasis. Nikolsky sign, Buller-Spread sign and Esbo-Hensen sign, these are generally used for bullous disorders. Like Nikolsky sign is positive in pemphigus. Buller-Spread sign can be seen positive in pemphigus as well as bullous pemphigoid. Esbo-Hensen sign is also not specific and can be seen positive in pemphigus as well as bullous pemphigoid. A patient get pricked by a rose thorn. Now, after this prick, develops ulcer along lymphatics. All these are the clue towards sporotrichosis. Sporotrichosis is also known as Rose Gardner's disease. First clue here, nodulo-ulcerative lesions are seen. So ulcerative lesions, and these lesions develop along lymphatics in linear fashion. So this is sporotrichosis, which is caused by Sporothrix-Shiansky, and aspergillus generally involves lungs. Candidiasis, all of you know, like oral candidiasis or candidal balanoposthitis, and Fonsesia group of fungus generally causes chromoblastomycosis. So answer here becomes Sporothrix, because this is a case of sporotrichosis. Here again they are asking about the deficiency related to this patient, and in the image there are red erythematous rashes which are present over face and in the diaper areas. Now these are characteristically seen in which condition? Acrodermatitis enteropathica. So in acrodermatitis enteropathica, what happens, that patient start developing this dermatitis or inflammation of the skin over acral areas like hand and feet, perioral area or diaper area. This is very common in young toddlers or infants, and they also suffer from intestinal issues like diarrhea. So this is due to zinc deficiency, and this is known as acrodermatitis enteropathica. So these were some of the important questions which were asked. There was one more question where they asked that what will be the ideal treatment for this condition. Now here what you can see, that there is a bump which is present over the skin, and this is inflamed. Patient is having lot of pain because there is a lot of inflammation which can be seen here. So probably this is a boil. Boil or furuncle is due to infection around the hair follicle, and this can lead to accumulation of pus there, and that's why we need to treat this infection by giving antibiotics. And if pus is accumulating, we need to do IND, that is incision and drainage. So antibiotic with drainage should be the ideal treatment. Biopsy is generally done when we are in confusion that what the patient is suffering from. So if we have a dilemma to identify the condition, we do biopsy. So biopsy is not needed here because clinically it is very evident that the patient is having boil. Similarly, wide excision is generally done for any malignancy or any tumors. So this is also not needed here. And antibacterial soap help in prevention, or in the initial stages it can be helpful, but once there is a lot of pus accumulation and the boil is there, then antibiotics will work and not just antibacterial soap. There was one more question which some of the students said, that there was a penile lesion which was mentioned, and there was a pink or the red color penile lesion was present over the glands, and one of the option was lichen sclerosus. Okay, so remember that lichen sclerosus can present with such red colored lesions over the penis, or sometimes it can be seen in old females as well. LSA, that is lichen sclerosus atrophicus. So if that was there, then do comment in the chat box and let me know what were the other options which were present there and what exactly the language of the question was. So I will definitely discuss that as well. Okay, so thank you very much. I hope this session was useful for all of you. All the very best.